Obesity is a global crisis, affecting over 1 billion people worldwide, and it's only expected to worsen. But what if there was a new approach that could offer hope to millions? The World Health Organization, WHO, has just endorsed a groundbreaking strategy to tackle this issue, and it's not just about popping pills. Here's the scoop. As of December 1, 2025, the WHO officially recommends using glucagon-like peptide 1, GLP-1, receptor agonists as part of a comprehensive treatment plan for adult obesity. But here's where it gets controversial. These medications are just one piece of the puzzle. The WHO emphasizes that drugs alone aren't enough, they must be paired with behavioral and lifestyle changes to truly make a difference. Is this the balanced approach we've been waiting for, or are we missing something? This new guideline, the first of its kind from the WHO on pharmacological treatment for adult obesity, ages 19 and up, is based on moderate certainty evidence that GLP-1 agonists like Liraglutide, Semaglutide, Wegovy, and Tirzepatide, Zepbound, are effective when combined with other interventions. Tirzepatide, in particular, stands out as a dual agonist targeting both GLP-1 and glucose-dependent insulinotropic polypeptide, GIP, receptors. And this is the part most people miss. The guideline also recommends intensive behavioral therapy focusing on diet, physical activity, and other lifestyle factors for adults prescribed these medications, though this advice is based on low-certainty evidence. WHO Director General Tedros Adhanom Ghebreyesus, PhD, was clear at a recent briefing: medication alone will not solve the obesity crisis. Obesity is a complex disease requiring lifelong, comprehensive care, influenced by social, commercial, and environmental factors that demand action beyond the clinic. His words highlight the multifaceted nature of the problem and the need for systemic change. But does this approach go far enough, or are we overlooking critical aspects of accessibility and equity? The guideline is part of a broader strategy with 3 pillars: creating healthier environments through policy, protecting high-risk individuals through early intervention, and ensuring lifelong, person-centered care. In September 2025, the WHO added these GLP-1 agonists, along with Liraglutide, to its list of essential medicines for high-risk adults with type 2 diabetes, including those with obesity. Yet, with obesity linked to 3.7 million deaths globally last year and expected to double by 2030, the urgency couldn't be clearer. In a special communication published in JAMA, Dr. Francesca Saletti and her team stressed that these recommendations are conditional. While GLP-1 therapies, with or without behavioral therapy, are effective, challenges like limited long-term data, cost, system readiness, equity, and patient variability remain. Implementation depends on equitable access to affordable therapies, health system preparedness, and person-centered care, they write. But how realistic is this in a world where healthcare disparities are stark? Tedros also raised concerns about equitable access to these medications. Without concerted action, these medicines could widen the gap between rich and poor, both within and between countries, he warned. We must work together on strategies like pool procurement and tiered pricing to make these treatments affordable for all. This new guideline is a key part of the WHO's acceleration plan to combat obesity, rooted in evidence and the principle of health for all. But will it be enough to address the scale of the problem? As we grapple with this complex issue, one question remains: how can we ensure that these advancements benefit everyone, not just those who can afford them? Let us know your thoughts in the comments. Do you think this approach is a game changer, or are there critical gaps we need to address?